Okay, so what happened is I'm going to tell you a story and then tell you more about it. I found out that people were getting better. There's a lot of, I've heard this over the years, for many years, based on the Nobel Prize winning work of Otto, what's his name?
Warburg.
Huh? Warburg.
Otto Warburg.
Yes. He spoke mostly about aerobic versus anaerobic metabolism. And the aerobic metabolism keeps you at a balanced pH. And the anaerobic creates a lot of acid and shifts the metabolism just slightly to acidic. So his thesis was disease cannot exist if your pH is balanced. In other words, your aerobic and your metabolism. So the blood pH, and I've studied this with great interest because in dentistry, we often overbreathe. It's like we overventilate. And like in an airplane, when people panic and they start hyperventilating, they have a bag to re-breathe your own exhalation to regain the CO2 that you're hyperventilating. Because when you exhale carbon dioxide. If you exhale too much, carbon dioxide is what keeps us in a balance. So your body becomes alkaline, and then you get into this alkalosis, which means a disease, a dysfunction related to an alkaline condition. You pass out and blah, blah, blah. So this has been in the back of my mind a long time, especially many people, they breathe through their mouth at night and unconscious. So whenever people breathe through their mouth, they exhale CO2, they become more alkaline and lose a lot of carbon dioxide, which is much more precious than oxygen. The blood, when it is saturated with oxygen, it takes on the oxygen at a certain pH. The hemoglobin will not pick up oxygen unless the blood is at a pH around 7.45. The blood will be saturated fully, 100% with oxygen, and it will not drop off the oxygen unless at the tissue level the pH slightly drops to less alkaline at 7.35. Some people say 7.365, but around 7.35. So the blood goes between 7.35 and 7.45. These are physiologic parameters that are quite inflexible because if you go outside them, you soon die. So the Nobel Prize winning physicist Niels Bohr, he won the Nobel Prize for discovering quantum physics. His father is Christian Bohr, and he was a physiologist. And he discovered Bohr's law, B-O-H-R. Bohr's law, huh?
Bohr's effect.
And Bohr's effect.
That's what they teach in physiology.
What?
That's what they teach in physiology.
That's what they teach, and I remember we had to learn that. So the Bohr's law, the Bohr's effect that's based on Bohr's law is this 7.45 pH to pick up oxygen, 7.35 pH to drop off oxygen. So it's like each tissue is a bus stop, and the blood discerns, is this worth dropping off oxygen at this location? So the body prioritizes where the oxygen goes. Anyway, oxygenated metabolism is very healthy and efficient. You get a lot of ATPs out of the conversion from glucose to ATP. When you go anaerobic, which is easy to do, then you produce so much lactic acid, and athletes know that about the muscles, and they get sore. It's from buildup of lactic acid. Anyway, long story short, here, one of the most famous medical places is called Scripps. You go there. What's it called? Scripps what?
Well, I go to just, oh gee, I have a little bit of dementia, so.
Okay. All right, so it's a medical institute.
Scripps,
I go to this.
Memorial Hospital.
Okay, Memorial Hospital.
Yeah.
Famous hospital, people go there when others cannot find a problem. And there was this one physician who had a patient who was terminal with prostate cancer and was given a very short time to live. And he referred this patient to another doctor who said, how long does he have to live? He said, well, a week, maybe a month. And he said, okay, that's plenty of time, don't worry about it. And this guy's practice was changing acid environment to alkaline environment. And he put him on whatever he did. Happened to be lemon, he liked lemons. That it creates an alkaline response. Long story short, I measured my pH when I reviewed all this in my mouth for the saliva, and I measured my dog's pH because the cancer was growing. The dog's pH was so alkaline, it's like totally blue on the litmus paper. My pH was acidic. So I treated myself by switching from drinking slightly acidic water, like Crystal Geyser is slightly acidic, and many natural sources are slightly acidic. But my tap water is slightly alkaline. And when I boil my tap water, it tests even better. So it's like a +10 water. It's excellent after boiling, and it's slightly alkaline. So I started to drink that, and I started to give my dog the acidic water. And that day, my wife was so busy, she had to go to a lunch to celebrate somebody's birthday. And she forgot to give our dog the vitamin D3 that normally she would give. So that day, our dog didn't have an optimal dose of vitamin D3 until the nighttime. The tumor shrank by at least 50% during that day. And the only difference was she was drinking slightly acidic water, neutralizing that it was so alkaline, that condition, that the thing was blue. And we have this litmus paper, and it was blue. It was like I hadn't seen that. So I thought, it's got to be that. So now I started to just give the water that was more acidic to the dog.
Crystal Geyser or the boiled tap water?
The boiled tap water is alkaline.
Okay, all right, so
But-
this one you gave the...
But I also have a distiller, and the distiller makes water acidic. It leaves behind a big alkaline residue, which is calcium hydroxide and calcium carbonate. It's very alkaline. So it's normally, because the Crystal Geyser is not always positive, and we try to have very positive, everything. So as I said this morning, we want the most positive thing. So just by this little thing, knowing this, it is so convenient. It's not difficult. You just give that kind of water. And I wanted you guys to know that. So I brought some water to show you, and I'm going to check this one. This is the litmus paper.
That's the distilled water you have?
Well,
Oh.
so this one, yellow and slightly green, is acidic.
Pretty close, here's the camera.
Is that?
Yeah, beautiful.
All right, so this is slightly acidic. So this is the distilled water. And the distilled water is good for just 24 to 48 hours. I mean, it is not good a long time. But the water is like living water. So this is the tap water that has been boiled. Okay, and I'm going to show you. It even turns the water slightly blue.
So it's the same water, one is distilled and
This
one
one-
is,
And it
Oil.
takes a few seconds. It's not the same water. Oh, I see what you mean, the original water.
so the source is
Yeah, the source. The source is our tap water. And we are very fortunate with good tap water. But there's a big difference between these two.
Yeah.
And, one of them is almost yellow, the other one you can see the blue is now aggregating here. Okay, and just, I just wanted you to know, because what I'm doing now is I'm recommending all my dental patients, because an acidic oral cavity leads to many cavities. Cavities. I never thought about that before. Oral cavity leads to so many dental cavities. And if a person finds out in the morning, first thing in the morning, you find out what is the pH in your mouth. If it's alkaline, well, it doesn't take a lot to shift that slightly to the, if it's alkaline, you shift to the normal, neutral. Now, I remember whenever you call an ambulance or you go to the hospital in emergency, first thing they do is put an IV for normal saline. Normal means 7 pH. Because if you're somewhat alkaline, it brings you to normal. If you're somewhat acidic, it's a lifesaver. It is one of the best things they do. So it's very similar to that. Now, I started to find a book, because it turns out, you know, when I was I was 16, I didn't speak much English. I learned English between 12 and 16, and my mother used to take me to these orthomolecular psychiatry meetings when I was 16, and one of the speakers, many speakers, but some of the speakers, I still remember, they're written up in this book, and there's now books written about the people I used to listen to, because they have died, but they made contributions. So this is a book I recommend very highly, called The Acid Alkaline Food Guide, because it contains hundreds of foods and tells you whether it's slightly alkaline producing food or moderately, or I think that's it, just 2 categories.
Who is the author?
Yeah, it's 2 authors, but just go by, just Google it under Acid Alkaline Food Guide. It's a Dr. Brown and a Larry Trivieri. And they have done the work for us, so that if you tend to be, first thing in the morning as a dentist, that's when I want you to take your oral pH. Because you wake up, the saliva's been going all night, and you're truly getting a reflection of your metabolic condition, whatever saliva is produced. So if you're getting saliva that's highly alkaline, which, by the way, my wife, she was highly alkaline. I'm acidic. And so, we had everything in the family here. So for her, I just switch her to the different water, to the slightly acidic water. And for me, I switch to the alkaline water. Do you guys get this? Is this too confusing?
No, I used to do
Very
that.
simple.
I have some papers still at home, but
Okay.
I don't remember. It's been a long
All right, well, what I'm encouraging you to think about is, in addition to everything is O-ring positive, you can select your foods that help you slightly adjust your pH in the correct direction. And people who have diseases, according to all the documents I'm reviewing, the more out of normal they are, the more disastrous the diseases get. So this doctor who saved this particular person's life, who was supposed to only live for weeks, he did it by this kind of shift. Now I happen to have all this still from having studied this. There are some supplements that are made. This one happens to be by a company called 7.2, because that's their pH goal, is that you be 7.2. This is Alkaline Booster. Instead of just sodium bicarbonate, which is what most people use, baking soda, to normalize the pH if they're acidic, this has calcium, magnesium, sodium, and potassium bicarbonates, which are, the basic minerals. And in order to see, our system is so acid producing in its metabolism that it's amazing that we're really supposed to be neutral or slightly alkaline, and that condition has to be that we're able to always neutralize the acids we produce through normal metabolic processes. To do that requires a reserve